Local Factors That Cause Direct Damage by Haley Malcolm and Delana Hockenhull. Some local contributing factors that may cause direct damage to the periodontium include food impaction, patient habits, oral piercings, occlusal forces, and normal anatomic factors. These factors may also alter the progress of periodontal disease at individual sites. When local contributing factors that may cause damage to the periodontium result in injury, that is called a factitious injury. Factitious injury is defined as a self-inflicted injury done by the patient that's usually committed inadvertently or by accident. Usually, a lot of the time, the patient does not even know that what they're doing as a habit is causing them to have a problem. However, when a patient injures themselves with bad intent, that injury is defined as intentional injury. Intentional injury by the patient is hard to diagnose because a lot of the time the patient does not divulge their issues to the doctor. However, if a patient does admit to the doctor that they're injuring themselves intentionally, the doctor has an ethical decision to make, which usually follows with them providing resources for mental health care. The first local contributing factor that I'm going to cover is food impaction. Food impaction refers to food that's forced between the teeth by occlusal forces, or biting. This can occur during chewing, usually tough foods such as steak, and leads to the food being trapped between the teeth or in the interdental area. Food impaction can strip the gingival tissues away from the tooth surface and can contribute to periodontal breakdown. The food that's left behind can serve as nutrients for tooth-decaying bacteria to feed on. Food impaction leads to alterations in gingival contour when the gums are pushed down, and that can result in interdental areas which are difficult for patients to clean on their own. The next local contributing factor that we're going to be discussing are patient habits. The patient habits that we have listed here are misuse of plaque biofilm control aids, thrusting of the tongue, mouth breathing, and traumatic toothbrushing. Some plaque biofilm control aids that you may be familiar with include toothpicks or interdental floss-ups. These aids can damage gingival tissues directly, altering their natural contours if used improperly. Tongue thrusting is the action of extreme lateral pressure on the anterior teeth with the tongue. This causes the teeth to move outwards. It can be very traumatic to the periodontium and could lead to long-term damage. Mouth breathing is the action of air being inhaled and exhaled primarily through the mouth rather than the nose, usually as someone sleeps. This can cause the gingival tissues in the anterior region of the mouth to start drying out. Traumatic toothbrushing is the action of aggressively using a toothbrush in a horizontal method or a rotary method. This can cause gingival inflammation and plaque accumulation. The periodontal tissues can become traumatized, causing gingival recession. Traumatic toothbrushing usually occurs when a patient is not educated on how to brush their teeth at home or have a very strict regimen on how they brush their teeth. Another local contributing factor that may cause direct damage to the periodontium includes oral piercings. An oral piercing, while trendy, can be damaging. Oral piercings are defined as the placement of foreign objects through tissue within the oral cavity. Direct damage is caused by the piercing when it mechanically traumatizes periodontal tissues. The most common adverse effects of oral piercings are gingival recession, infection, swelling, bleeding, tooth fractures, and potential allergic reactions. Patients should always be informed of the potential damaging effects of oral jewelry, and as always, they should be removed prior to having radiographs taken so that they don't disturb the radiograph quality. Another local contributing factor that can cause direct damage to the periodontium is damage from occlusal forces. Direct damage to the periodontium can result from excessive occlusal forces on the teeth. Trauma from occlusion occurs when excessive occlusal force causes damage to the periodontium. There are two classifications: primary trauma from occlusion and secondary trauma from occlusion.
So, primary trauma from occlusion is defined as excessive occlusal forces on a sound periodontium with no previous history of periodontal breakdown. So, examples of the causes of primary trauma from occlusion include inadvertent placement of a high restoration or insertion of a fixed bridge or a partial denture. So, these can put excessive pressure on periodontally healthy teeth. So along with primary, there is secondary trauma from occlusion, and this occurs when normal or excessive occlusal forces are placed on a teeth with an unhealthy periodontium, previously weakened by periodontitis, thus contributing harm to an already damaged periodontium. So unlike primary, this is occurring with an unhealthy periodontium that has already been weakened by periodontitis. Some causes of this is weakened bone and height of the teeth from periodontitis, forces that cause the lateral movement of teeth, and then pressure on the bone from that lateral tooth movement. Types of occlusal forces. So there are two different types of these forces. There is functional and there is parafunctional. So, starting with functional occlusal forces, these are the normal forces that are produced during the act of chewing food. This is also known as mastication. And then secondly, there is parafunctional occlusal forces. So, this is the result from tooth-to-tooth contact made when not in the act of eating or chewing food. So, bruxism would fit in this category of a parafunctional occlusal force. This is the grinding of the teeth in a forceful manner. And then also clenching fits in this category, which it's when the maxillary teeth are constantly or intermittently forcefully closed against the mandible, which these two things can actually happen due to nervousness or even when you're sleeping and you could be completely unaware that this is actually going on. So these habits cause excessive force of the teeth and the periodontium, which can cause damage. So, for the individuals that are experiencing these parafunctional habits I just previously discussed, there are clinical therapies that can be done to help control them, and these can include occlusal adjustments and acrylic appliances. So starting out with the occlusal adjustments, so this is when there is trauma from a faulty bite, and minor adjustments will be done by selective reshaping the occlusal surfaces of the teeth, and this is done to eliminate the occlusal interferences, and it will minimize the damaging forces. And then the acrylic appliances. So the dentist can fabricate an acrylic appliance known as an occlusal appliance, and these can also be called occlusal splints or even called a night guard, and these protect the teeth when trauma is from the result of bruxism. So as you can see on the slide, this picture is an example of what one of these appliances would look like, and tying into what I talked about on the previous slide with bruxism is that you can even be sleeping and unaware that you are grinding your teeth. So wearing one of these when you're sleeping is actually very beneficial because, like I said, you're unaware when you're sleeping, so having this protective guard on your teeth will prevent that further damage to the teeth when you're sleeping and unaware and can't control your actions. So, another one of the local factors can be caused by normal anatomic factors. So, usually these normal anatomic factors don't cause injury to the periodontium, but there is one exception, which includes an individual having a high frenal attachment. So, in the picture, this is what a normal one looks like, just to show you guys, give you an idea of what it does look like. So a frenum is a thin fold of mucous membrane with enclosed muscle fibers that attach the lips to the alveolar mucosa and underlying periosteum. The primary function of a frenum is to provide stability to the lips, cheeks, and the tongue. If the gingival margin pulls away from the tooth due to lip movement, a frenum can become a significant issue. So when an abnormal frenal attachment is located near the gingival margin, the gingival sulcus will be distended, and since the muscular fibers in the frenum are constantly pulling on the gingival margin, this is also referred to as a frenal pull. This pulling on the gingival margin can cause gingival recession. So by performing a frenectomy, the abnormal frenal attachment can be removed, but in the absence of removal, it will continue to pull down the marginal gingiva and make the exposed root surface more vulnerable to plaque biofilm accumulation. There is also a risk of root caries and or periodontal disease as a result of this. So it's very important to take the correct steps into fixing this so that the tooth and the periodontium can stay in good health. Overall, it is important for dental hygienists to be able to recognize local factors such as plaque biofilm retention and direct damage to the periodontal tissues. Monitoring patients for signs and symptoms of gingivitis or periodontitis is critical during patient examination. Prevention and early treatment of these problems can decrease the risk of a more serious disease. Okay, so to finish off, these are our references, and thank you for listening.